Well, good morning. We have Dr. Larsen here for our Pet Doctor segment with a beautiful little kitten.
I have Grayson. Grayson's a little girl. She's 11 weeks old and very calm.
Yeah, very calm. Lots of interesting colorations.
Checking things out here.
Good thing we have a cute cat because we're not talking about a very nice subject. We're talking about a very serious disease called Feline Infectious Peritonitis.
Another name for it is FIP, which is the abbreviations for the Feline Infectious Peritonitis. Now, it's a virus disease, Tim. It's actually a coronavirus. Now, there are a lot of different coronaviruses out there, and there's subgroups of them. And this is the feline coronavirus, not contagious to other animals besides cats.
Okay. What are the clinical signs that you're looking for?
The cats with feline infectious peritonitis that come to see me are already sick. They're not eating, they run a fever, they've been losing weight. The feline infectious peritonitis will have two different main ways that it forms. It has a wet form and a dry form. Now, what's that mean is the chest and the abdomen will fill fluid with feline infectious peritonitis to a point where they can't breathe very well.
Okay.
So they have trouble breathing. If their tummy, if they get the wet form in their abdomen, it's a bloated look. They look like they have a heavy case of worms or something. The dry form, on the other hand, doesn't have that. But what it has is a sick cat that the organs are affected with. Now, feline infectious peritonitis can be a very severe disease in cats, and if they become sick with it, and I'll be explaining that in a minute, sick or not, they can succumb to it.
And you said it's only contagious between cats, not other animals?
Not other animals. Not people, not other animals.
So that's the good news there.
Yes.
What kind of an incubation period does this typically have?
Incubation period is the time from when the cat came across the virus till the time it's shedding the virus.
All right.
Boy, that's highly variable, Tim. It can be as short as 2 weeks. It can be years long.
Oh my.
And you don't know your cat's sick with this. You don't know it's got the virus. And actually, FIP then goes into different stages of the disease. After they've incubated, it is actually 3 main stages. Stage 1, Tim, is where the cat is shedding virus, not the incubation period. That's when before they start shedding virus. Shedding the virus, but they're not sick. Stage 2 is they're not shedding virus any longer, and they're not sick yet. But and that can be for years and years. We call that going into dormancy.
Wow.
You don't know they have it. They don't bring the cat in because it's sick. Cause it's not
why
sick.
would you?
But stage 3, that's the bombshell. That's when they are sick. They get this fluid in their chest or in their abdomen, or they're just not eating. They have a fever, and that's the one that where we see them as
treatable.
Now, the contagiousness. You asked me that too, Tim.
Oh yes, go ahead.
The contagiousness. Stage 1 is highly contagious. They're not sick. Remember, they just.
But that's when it's most contagious.
Most contagious.
Oh my.
And then stage 3, where they're sick with it, they're the least contagious.
That doesn't make any sense. All right, how do you treat it? Big question.
No answer.
Oh, man.
It is because it's a virus, we don't have antiviral drugs that treat them. And now this is for the sick cat. Now, we don't know they have it unless we test them otherwise. But if they're sick with it, we don't have a treatment. We can treat them for clinical signs. But we don't make a lot of difference, Tim. Sometimes cats, on a rare occasion, will survive it. Most of them don't. Most of them pass away.
Can you prevent it then?
Only way we can prevent this is there is a vaccine we can vaccinate. It's controversial whether it is very protective or not. Also, keep your cat away from other cats. Now, the trick is you don't know the cat's sick or not.
That's true.
Because when they're healthy and acting good, that's when they're most contagious.
All right, some good information there. Thank you, Dr. Larsen.
You're welcome, Tim.
Good cat, too. We'll be coming right back. Stick with us.